Good morning, Facebook. Today we're going to be focusing on some home care. We know some people have self-isolated due to the coronavirus, so we wanted to go over some things that you can do at home. You might not be able to get out of the house to get to the chiropractor or your medical doctor, physical therapist. You might not even be able to get over-the-counter medication or prescription medication. So what are some things you can do at home? Well, one of our favorite things to use is ice at home. Now, there's a controversy about ice versus heat. Well, it's better just to go with ice all the time, whether it's a new injury, old, or it's an old injury, okay? Now, first of all, it's nice to have like a big, soft, flexible ice pack, and it's much more comfortable. It makes the ice a lot more tolerable, and we have these at the office. We've had these custom made, so people really like these. We actually have had MDs come in to buy them because their patients have told them about them. But if you want to get something like that, you can make one with alcohol, rubbing alcohol in water, and put it in a Ziploc bag. You can make something like that, or use a bag of frozen peas. You always want to cover the ice pack. We have these sleeves, but you always want to put a soft towel or a hand towel around the ice pack. Now, for most people, they're using the ice when they're in pain, okay? If the more it's acute pain when you're doing the lower back, you want to do it with your knees bent, just with your lower back flat. Now, if the chiropractor is specifically working on bringing the head back over the shoulders and putting the curve in the neck or restoring the lumbar curve, we'll do it a little bit differently. So we'll show you both of those ways, okay? So with the neck, we're going to do it with a rolled towel under the neck, and I'll show you the two different ways. With the low back, we're going to start flat, okay? So you're going to put a flat ice pack under the lower back with the knees bent. That's going to take the pressure off the nerves. If you have a pinched nerve in your neck where you have numbness and tingling in the arms or pain in the arms, we'll start off with the head slightly flexed forward till that settles down. If you're not having any of those, then you want to be bringing the head back over the shoulders and putting the curve in the neck. So if you have chronic pain but you don't have the referring pain, then this is going to help to restore the head back over the shoulders and the curve in the neck. The knees bent is going to help take the pressure off the nerve in the lower back. Now, if the chiropractor is also working on restoring the curve in the lower back, the forward lordosis that some people may have a loss of, then you're going to also put a rolled towel underneath the ice pack in the lower back. So then you're going to look like this, bringing the forward curve in the low back, forward curve in the neck, just like this, okay? Now, how long do we do this ice? Well, you want to do 20 minutes every 2 hours. Well, why is that? Well, there's something called the Lewis-Hunting reaction. The first 10 minutes of the ice, the first 20 minutes of the ice, it's pulling fluid and inflammation away from the area. After the first 20 minutes, your body realizes it's cold and starts to pull that blood back into the area, so it's going to cause swelling again. So you want to do 20 minutes on, and then you have to wait for 2 hours to do it again, because it takes 2 hours for your body to forget about that you were trying to make it cold and wanted to warm it up. So 20 minutes on, 2 hours later, do it again. Doesn't matter if it's new or if it's old. This heat and ice thing has been around for a long time, the controversy, but it's always safer to go with ice. You can never go wrong with it. Think about a major league pitcher. A guy pitches, he puts the ice pack on, right? If you put heat on, then the shoulder would swell up any more. If you look at a NBA basketball player, at the end of the game, you'll notice they wrap ice packs around their knees, and if they wrapped heat around their knees, it would cause more swelling. So heat gets rid of all the inflammatory, ice gets rid of all the inflammatory properties and breaks the pain cycle. Heat drives inflammation and all kind of chemicals that cause chronic pain. So whether it's new or old, it's always better to use ice. Now, some people don't tolerate ice very well, and those people can use moist heat. Now, if you use moist heat, you want to do it for 10 minutes. You'll either be in the tub, the shower, or you can take a heating pad with a moist towel on top of it, and that's called moist heat. You'll do that for 10 minutes, then you'll do the ice for 20, and it'll make the ice more tolerable. It's normal to go through some symptoms with the ice. We call it C-band, cold, aching, burning, numbness. So you have to go through the whole 20 minutes to get the pain relieving part of it. Now, our office is still opening. We are spacing the patients out. We do have a sign at the front door. If there's any symptoms, we want you to call us. If you're having a fever, respiratory problems, cough, if you've been out of the country in the last few weeks, we want you to call us before you come in. And then we're spacing the patient visits out. We're disinfecting the office in between each visit. The governor does want us to stay open because he doesn't want people that are having complaints, much to the skeletally, to be going to the ER. He wants you to get that taken care of somewhere else. So our office is staying open to keep people out of medical doctors and the offices and the emergency room offices. So we're here for you. If you try the heat or the ice and your symptoms stay the same or get worse, give us a call and we'll be happy to give you some advice. 904-679-3233. Hartley Chiropractic and Scoliosis Center. This is Dr. J. Hartley in St. Augustine, Florida. Have a great day.